Welcome back to Yahoo Finance Live. I'm Anjalee Khemlani. Startup Carbon Health is partnering with CVS Health to bring its primary and urgent care services to select retail stores after receiving a $100 million investment from the healthcare giant. The boost comes at a time when Carbon is right-sizing its business. And here to break it all down is Carbon Health CEO himself, Eren Bali. Eren, thank you so much for joining the show today.
Thank you for having me.
So there's a lot going on at the company. Let's break this down first. So company gets its name on the map during the pandemic. You stand up testing sites, everything going well, money flowing in, investor sentiment high. And now you're in a position where you've had to right size and downsize in the past several months. So talk to me about why you're pulling out from the verticals you are and how you are balancing everything out with this CVS partnership.
So we built a very ambitious plan in the last several years where I think I had communicated the goal was to become a nationwide primary care provider by 2025. And we started expanding very fast in the last several years. But our growth at the end of the day requires capital, access to capital. And when the capital markets crashed this year, we had to change route and open fewer clinics, slow down our growth, pretty much completely a reaction to public markets.
And noticing on that map that you just saw, you're in 13 states now, you have physical locations there. You also were looking at chronic care as one of the verticals, as well as remote patient monitoring. That seemed like something that came as a result of the pandemic. So tell me why you've chosen to stick to primary and urgent care versus, moving up on those scales.
It was mostly a result of the fact that if our clinics don't grow, we don't have as many clinics, we won't have as many patients to be able to have specialized programs. So what we end up doing is we took the capabilities we built and brought it back to our primary care service. And that's in line with actually the way healthcare ecosystem is going. So essentially we are doubling down on value-based primary care. So instead of having chronic care management programs as independent services, we bundled all of those back to our primary care offering, and we have value-based care partnerships so that we don't have to monetize them directly. Instead, we are monetizing them through our primary care service.
I'm going to take a stab here and wonder if it's related to what you said in the statement with the CVS agreement, which was, quote, while healthcare has evolved tremendously over the past few years, there's still many ways in which care delivery and quality have not. Tell me the ways that they've not. Is this mostly on the payer side you're finding that it's harder to really move the needle?
I would say in payer side, there's a lot of friction to provide a more innovative forms of care when you have to go through a fee-for-service model where we have to bill for every interaction we are coming up with, versus there's a new model called value-based care, which has been around for a long time, but still hasn't been adopted as widely as we would hope. In that model, instead of getting paid for every service, you get paid a lump sum amount, and then you have more freedom to provide the type of services you want to provide. So we think that's actually very critical to unlock the type of primary care we want to provide. We call it connected care. So the idea is, while traditional primary care providers really rely on visits, we believe everything that happens in between visits is really what everyday healthcare is about. We do things like logging symptoms and setting goals, using devices to track data in a longitudinal way. We have a lot of non-traditional forms of care, which is hard to monetize through traditional insurance billing process.
I know, I was kind of sad to hear about the chronic care part. I feel like that's so sorely needed in the country, but hopefully you can get back on track there. But let me ask you about electronic health records, because I know that that's something that you were discussing as late as December. Where are you with that? Do you still see technology licensing as an avenue for the company?
We definitely see it as an avenue. We built our entire technology platform, the EHR, patient app, everything as a single technology platform from the ground up. And when we look at other tech-enabled service providers, we sometimes replace 13, 14 different tools they're using with just a single technology platform. So we are already in a lot of conversations, and that is definitely going to be a huge growth area for Carbon Health.
Sounds good. Well, we'll have to leave it there for now. Eren Bali, Carbon Health CEO, thank you so much for joining us.